everyone, and welcome back in the insightful episode of MedSynapse podcast series where we connect clinical insights with real world impact. I'm your host, Hetvi, and today we're diving into a topic that sits at the intersection of medicine, innovation, and social responsibility. In a country as diverse as India, healthcare inequity remains one of the most pressing challenges, from rural access gaps and resource constraints to affordability and continuity of care. But at the same time, we are witnessing an unprecedented digital transformation, telemedicine, AI-driven, and mobile health platforms that are reshaping how we deliver healthcare, especially to those who need it the most. And to help us unpack how technology can truly become an equalizer in healthcare, we're joined by Dr. Mirza Alamdar Ali Baig, an internal medicine specialist who's deeply passionate about innovation, affordable care, and building trust-driven healthcare ecosystems through technology-enabled solutions. So, Doctor, welcome to the show, and it's such a pleasure to have you with us today.
Thank you, Hetvi, and thank you to the MedSynapse team to get me on this podcast. It's an honor to be here.
So, Doctor, I was just going through your work. So, from your perspective, what are the most significant inequities in healthcare access across urban, rural, and underserved regions in India, and how can technology actually bridge these gaps?
So, in my perspective, healthcare inequity in India can be put into three broad subheadings. One is the geography, affordability, and workforce distribution. Nearly 65% of our Indian population resides in rural areas, and according to the National and World Health Organization, the most of the urban centers have specialists and rural don't have specialists. So this is one of the major concerns for a country like India in inequity of healthcare access. Second is affordability. Again, data shows that our majority of the population has expenditure, out of pocket expenditure, and they don't have any insurance or any other methods of payments. So that also causes a big burden for the population. The third thing is the diagnostic access. Major diagnostic labs, pathology, let it be radiology, are present in tertiary case or in the urban centers. But in tier 2 and tier 3 cities, this is a major problem. So using technology, how do we bridge this gap? What we have been doing and what India has been doing right now is implementing technology, implementing AI in providing access to healthcare. So how it's doing, enabling a teleconsultation. So teleconsultation has taken a major push post-COVID, and India is seeing a huge chunk of consultation happening over teleconsultation, and this is making a big bridge between cities and rural areas, specialists and payer and population. Then again is point of care diagnostics. Point of care diagnostic again is where we are using technology and AI to providing a real time diagnosis for patients in rural settings or in urban settings also. And by providing all this infrastructure, we are slowly progressing towards equity of healthcare.
Correct. I think that's a very important perspective, especially highlighting how these gaps actually help and shape patient outcomes also. So thank you for sharing that, Doctor. So building on that only, how has a rapid expansion of telemedicine and digital health platforms transformed care delivery, particularly in resource-limited or remote settings?
So, like I said earlier, teleconsultation post-COVID pandemic has taken a rapid rise. The Medical Council of India gave guidelines in 2020 for teleconsultation, and we have national platforms like eSanjeevani and other private platforms where we have teleconsultation, which is ongoing at rapid paces. It's growing exponentially. So, how teleconsultation or telemedicine or digital transformation of healthcare helps in bridging this gap? See, technology reduces the distance between a patient and a doctor. This is what we're planning to do. It is this reducing a distance between the patient and a doctor, or a doctor to doctor. Doctor to doctor in the sense, a doctor and a specialist. A doctor in public health service or a public health center in a rural area can talk to a specialist or refer a patient or discuss about a patient condition or treatment over a teleconsultation app. So one is specialist access without travel. So anyone can access a specialist from any part of the town, any part of the country through teleconsultation. And especially in chronic diseases. Now, see, chronic diseases are something where patient needs continuous follow-ups, continuous guidance. Correct? So now they cannot travel every time for a consultation to a tertiary care or to a higher safe center. So if they are enabled on a teleconsultation with electronic medical records, so their continuity of chronic care diseases is seeing a rise. Reduced system burden on tertiary cares. So what happens is in tertiary hospitals, what is happening is because of the patient load, all the patients are traveling from rural areas or uh, uh, under-privileged areas to higher centers, the OPD burden, the doctors' specialist burden is increasing. So they are overworked and under-resourced. So once we bridge this gap by having teleconsultation and follow-ups, we can reduce the burden even in OPDs and equally distribute our resources.
I think the way telemedicine has brought a continuity of care closer to patients is truly remarkable. So now, from a clinical standpoint, what role do AI-driven decision support systems and predictive analytics play in improving early diagnosis and optimizing patient outcomes in India? Because I think even I have seen this change, especially with AI coming into picture.
So, see, the role of AI and predictive analysis is very powerful in a setting like India, which has very low resources in terms of medical, diagnostic, and specialist care, and high population burden and rural area population. So, predictive analysis and AI is doing wonders here. So, we have seen the government and also the private players implying analytics, AI analytics, to have point of care diagnostic, like I mentioned again. So, what example like TB screening. So a person can go to a public health center in a rural area, get a TB X-ray up, or so AI diagnosis nodules, simple nodules. So predictability, specificity is high in that kind of cases. To TB screenings, we can monitor and treat cases. Diabetic retinopathy is seeing a rise of AI studies. Then arrhythmias, ECGs. Correct. ECGs are one of the leading diagnostic point of care systems where we have real time ECG analysis from we can diagnose arrhythmias to EC acute MI or any other abnormalities on the spot. So this kind of examples give us a very important and powerful load of predictive analysis and AI in healthcare as of now.
Correct. I think that's so insightful, especially the emphasis how AI is changing the diagnosis is interesting to know. And doctor, like when we talk about scaling these health tech solutions, what practical challenges do clinicians face in terms of digital literacy, infrastructure, limitations, and workflow integration?
Yeah. So this is again one of the see with technology shouldn't be a burden to any of them. Let it be the clinician and let it be with the patient. It shouldn't be a burden. It should be an add-on, like a partner or easy of access. So scaling health tech in India again comes down to again your population. Again comes to the urban and rural settings, which is a big chunk of population where we have limited resources in terms of PHCs, public health sectors without digital connections, internet access. Okay, internet access, mobile accessibility, and again healthcare workers training is not up to the mark. We have to implement training of healthcare workers with digital and AI driven subjects as of now, and also clinicians, older clinicians. Some of them have been adapted to these changes in technology, but few are still because the learning curve is a little bit steep, so they are having difficulties in learning this AI driven telemedic consultation and analysis.
Very true. I think adoption is as much about people and processes as it is about technology itself. Then, doctor, how can technology be strategically leveraged to strengthen preventive care, screening initiatives, and chronic disease management among vulnerable and high-risk populations, especially?
So right now, India is transitioning from a communicable burden disease state to a non-communicable disease state. So we are going away from diseases like TB and malaria and dengue towards diabetes, hypertension, cardiovascular diseases. These are chronic diseases and they require regular management and early diagnosis. The key here is early diagnosis, which will reduce the burden on the patient and also healthcare system. So if the diagnosis is delayed, the cost of treatment increases, the cost of patient no, awareness also increases. So what telemedicine medicine or AI is doing here is early uh, diagnosis and management, regular follow-ups, screening, SMS reminders are going for patients to take the medicine on time, digital BP and glucose monitoring, which you have seen nowadays, which have also AI built in them, which are helping patient to understand the diseases and continue medical care. There are you can do portable digital cabs, where the whole access like CT and X-rays and mammograms go towards the public health centers, and we have those cabs also which are AI driven. So multiple things are happening in chronic disease management. This is one of the biggest tools, AI and telemedicine, which is helping India to become stronger and provide equitable healthcare around the globe.
I think that really highlights how proactive data driven care can shift the focus from treatment to prevention. And I think this is where we can work more also in India. So, Doctor, looking ahead, which emerging technologies, such as remote monitoring, mobile health platforms, or AI-powered diagnostics hold the greatest promise for achieving truly equitable healthcare access in India?
So, coming from a background of critical care medicine, also the biggest change I'm seeing is in remote ICU patient monitoring. So, patients in rural settings are being monitored remotely from urban specialists. So, there are connected BP monitors, glucometers, cardiac devices, which are giving real-time data and alarms and notifications to patients, to specialists sitting in urban centers, and they can guide the healthcare workers there, nurses, or the duty doctors there to take preventive measures. So, this is one of the most interesting things is happening with monitored ICUs, digital ICUs is happening. Then there again, like I said, AI-powered diagnostics for TB screening, cancer screenings, diabetic retinopathy, and ECG, low-cost ECG machines, which can be portable, which can be taken. And also nowadays, your portable USC is coming. So this can also be very helpful in setting like India, where scans need to be done by healthcare workers across the country. So digital public healthcare infrastructure. So like I mentioned, Niti Aayog, the healthcare map for India. The government of India has planned for excessive implementation of electronic medical records, Ayushman Bharat, Ayushman Digital Mission. They're creating a national scale records of all patients, so that ease of accessibility, ease of medical records, can be easily uh, continued towards care. Platforms in the hospitals like public health centers can become digitalized, can become modernized, AI driven. So this kind of challenges are being tackled slowly over the course of our growth in AI.
I think those are some very promising, well, future that we can see in coming, say, 5 to 10 years also. So it's interesting to know, Doctor. Doctor, as we wrap up today's session, thank you so much for sharing your expertise. And this has been an incredibly enriching discussion on how technology can move us actually closer to the goal of equitable, affordable, and patient-centered healthcare in India. So thank you for sharing your thoughts, Doctor.
Yeah. Thank you so much. Thank you so much for having me on podcast.
Same here, Doctor. And to our listeners, remember, if your healthcare professional is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay tuned for more conversations that bridge clinical experience with future forward healthcare. So thank you.